Welcome back to Regional Roundup. My name is Bing Kimpo. It's been several months now since vaccines were the subject of discussions. Back then, I remember several players had raised their hands to the call of producing them here in the country. I was writing for another show back then and I was able to interview Giovanni Alingog, founder and CEO of one of those companies, Glovax Biotech. Well, Glovax was in the news lately following its participation in the ASEAN Vaccine Development and Manufacturing Research Project Technical Regional Consultative Workshop. On Regional Roundup this episode, we're in a conversation with Giovanni Alingog once again to talk about producing vaccines here in the Philippines.
The Philippines, 17 regions and 81 provinces, spread across 7,641 islands, each one a home to people, places, and potential.
The Philippines, a member of ASEAN, the Association of Southeast Asian Nations, and BIMPIAGA, the Brunei Darussalam, Indonesia, Malaysia, Philippines, East ASEAN Growth Area.
There's definitely more to the Philippines than just the National Capital Region.
Find out more about what the rest of the regions that comprise our archipelago and the regional groupings that our country is part of have to offer to us and to the world on Regional Roundup.
Regional Roundup with Bing Kimpo, a closer look at the regions in and around us.
A wider perspective of our islands and our part of the world. Late last November, Glovax was invited to the Vaccine Development and Manufacturing Research Project Technical Regional Consultative Workshop of the Association of Southeast Asian Nations, or ASEAN. Now, what was that workshop all about?
So yung workshop is about participating in the regional context of vaccine supply and self-reliance. Every country in ASEAN should be able to provide their citizens with the complete vaccines, not only for COVID but also for other vaccines such as the children's vaccines and the adult vaccines.
Which vaccines are we specifically talking about here?
So for adult, we have influenza, pneumonia, meningococcal, tetanus, polio vaccines. And for children, we have the 5-in-1, the DTP, hepatitis B, and Hib, influenza. And also may polio and tuberculosis vaccine then for children, tsaka yung mga MMR, measles, mumps, rubella.
And what was the context surrounding the participation of your company, Glovax, in that ASEAN gathering?
We were invited because we are the only private company with the Memorandum of Understanding to pursue a vaccine plant project in the Philippines.
Speaking of vaccine plants, I understand that a number of our neighbors in ASEAN actually already have those in place, and that in fact they're producing vaccines there right now. According to the ASEAN Vaccine Baseline Survey, the vaccine-producing countries in the region are Indonesia, Malaysia, Singapore, Thailand, and Vietnam.
Their capacity is that they are able to export already to other countries. So imagine that. And tayo, magsisimula pa lang. But at least it's a start and we hope that we will be able to catch up.
Now, your company does have a standing proposal to produce vaccines here in the Philippines. Tell us a bit about that proposal.
So Glovax started in 2003 distributing all kinds of vaccines from BCG, which is the tuberculosis vaccine, influenza, meningococcemia, and all the other children's vaccines such as the pentavalent vaccine, polio vaccine, and the MMR vaccine, so the measles, mumps, and rubella. So from then on, we experienced that vaccine supply coming from international suppliers are sporadic or intermittent at best. No? Hindi tayo laging nasusuplayan. Minsan, ang government nagpapabids. Walang makapag-bid because wala naman nag-stock na foreign countries for our own sake. Vaccines are not always available. And to top it off, it's also expensive because we are importing it. So that's when we noticed that it's a problem if we don't have a vaccine plant to really have a sustainable supply. And it happened again in 2009, which is the first time na nagkaroon tayo ng vaccination against pandemic. Nung meron yung AH1N1 swine flu pandemic. We were again one of the last countries to receive this vaccine. As early as 2012, we brought in scientists, those who are in the know of vaccine manufacturing and vaccine industry. We brought them in the country and looked at existing facilities that our government are saying that they have. And from then on, these scientists were able to study that, we needed new vaccine plant because the equipment that we have are modular and are already obsolete. So, and by looking at the market itself, at the time we are about 100 million people. So they said that such a large population country should have a vaccine plant of their own. So that strengthened our desire and our resolve to continue this collaboration with these scientists coming from Korea and the US. They were brought by LG Chemical, one of the big conglomerate in South Korea, to study our market. And they became our tech transfer partner. So that's why in 2012, talagang minabuti na namin na mag-present ng unsolicited public-private partnership sa government na magkaroon na tayo ng talagang atin na vaccine plant. The government can be able to do it, but they cannot do it alone in such a way that they needed tech transfer partner. And the private entities naman like Glovax wouldn't be able to do it alone even if we have the tech transfer partner because it's the government who has the demand. So both entities, that's why it should be a public-private partnership.
Okay, so you've got a standing proposal that leverages the strengths of vaccine technology transfer partners. Please tell us a bit about these partners.
Right now, we have at least 4 tech transfer partner already who is willing to put up these vaccine plant, the formulation plant, and even the animal testing, clinical trial, and research and development part of it, and having a pilot plant. So they're just waiting for the go signal of the government. And with the new administration, that go signal will come from the investment of the National Development Company. So once we have that this year, we are ready to ground break by January and start construction.
Could you be more specific and name these partners of yours?
I already have mentioned LG Chem of Korea, and there's the U Biologics of Korea as well, which we have signed already with the DTI, BOI, and the NDC. The 2 others we cannot name yet because their assurance of participation is hinges on the participation of the government as well. Because we don't want to be in a chicken and egg situation. So these types of project, this long-term legacy project, should be initiated by the government with the support of the private entity like us.
Because we still are in a pandemic, much of the discussions regarding vaccine self-reliance and vaccine production relate to those needed to fight COVID. To be clear though, the plans of Glovax for this vaccine plant cover the other vaccines that we need as well, right?
So this covers the other vaccines that are necessary to us, not only COVID. Because remember, we already have the tech transfer agreement since 2012. So that's what we first achieved before talking to the government and saying that we needed the vaccine plant. Because at that time, we are already ready with a tech transfer partner for the existing vaccines that the DOH procures annually. So there was no COVID yet before. And so now, with that, the technology and the other partners that are willing to provide partnership with us will also include new vaccines that are not yet developed, the COVID vaccine, which we are already doing the local clinical trial, and for all other children's vaccine that we needed annually.
On the subject of COVID, I remember from our last conversation months back that Glovax was working with South Korea's U Biologics on doing clinical trials here in the Philippines for its COVID vaccine UCORVAC. How's that coming along?
As you know, clinical trial requires at least 20,000 to 40,000 individuals for testing. And it takes a lot of time and it takes a lot of resources to do that. In fact, U Biologics already have invested 40 million US dollars. And instead of doing that in India or in Africa or in China or even in any other country, because we have a very good partnership with them that we are going to put up a vaccine plant here locally, that they decided to invest these 40 million US dollars in the Philippines for the clinical trial. And they're already in stage 3 and hopefully it will be done very soon so that we would be able to produce that locally as well because we tested it locally. The clinical trial was started this early April and it should be done by April in 2023. So it's about a year of clinical trial.
Wow, $40 million for a clinical trial. That's a pretty serious investment. What's the upside for these partners of yours? Why choose the Philippines?
They were thinking of investing in Indonesia, Vietnam, and Thailand. So, but when they go there, there's already competition because there's already 4 vaccine plants. And if they come to the Philippines and partner with us, there is no competition. We will be the first vaccine plant. So that's one upside for them. Second, we are the second largest population in ASEAN next to Indonesia. So our market is growing. We have about, as reported in the ASEAN workshop, about 3 million births each year. And that's the biggest in Asia. So that's a very good market. Then the third one is we are a growing economy. So as compared to Malaysia and other countries, the Philippines' annual procurement for vaccine is only 8 billion with 110 million population. As compared to Malaysia, we only have 30 million people. They have 60 billion pesos equivalent to pesos vaccine procurement annually. So that's about what 5 times more for a smaller population. So with that kind of growth, so that's one of the upside that hopefully happened in the Philippines when we increase our procurement budget for preventive vaccines.
So I guess the question then is this: where is Glovax right now vis-a-vis your proposal for a vaccine plant?
We have put everything that is needed: the land, the tech partner, the seed money, our own investment. So we just need to really start it with, the assurance that the government will allow such legacy project. We are very happy and proud na ang ating new administration under BBM ay patuloy na gumagawa ng mga legacy projects na long-term project na katulad ng vaccine plant na kailangan talaga. Kaya ito na po siguro ang simula ng ating pagiging self-reliant at hindi tayo umaasa sa mga foreign manufacturers na padalaan tayo ng vaccine kung kailan lang sila merong sobrang stocks. So yan po yung ating sinusolusyonan dito sa pagkakaroon ng mass production vaccine plant.
Okay, let's be optimistic and say that you get this vaccine plant project finally off the ground. Tell us a bit more about the project. What will the milestones or phases be, and what will each milestone or phase achieve for the Philippines?
The fully integrated vaccine plant, which we always have been proposing, have at least 4 components. So the last part of it is the fill and finish component, which is the easiest to do. And that's also what we are trying to do on a first step, because we cannot do everything in one go because it requires time, and more specifically it requires 7.5 billion. So the fully integrated vaccine plant will cost 7.5 billion pesos. And so our first step is to invest 2 billion pesos for the fill and finish plant, but without stopping from there, because a lot of idea is that we should stop from there, and our idea is different from that, because fill and finish does not really bring any technology transfer. It's just transferring from bulk container to the smaller container, which is the vials. What we are proposing is a fully integrated vaccine plant wherein there is a formulation and production of the antigen. And then there's this animal testing and clinical trial setup. There's also this research and development and pilot plant wherein whatever we can invent as a private entity and together with the new Virology Institute, whatever they can invent, they can produce that in our own pilot plant and in our own mass production vaccine plant. So it will benefit the entire country, other participants in the industry as well, including the government agencies. So it's a holistic approach. So we are not focusing on just the easy side, which is the fill and finish. The first phase is to start construction as early as January next year. Be able to finish construction of the fill and finish in 1 year. And in 2 years' time, by year 2025, we should be able to start producing on the fill and finish plant. Meaning we should be able to come up with our own pentavalent vaccine, influenza vaccine, pneumococcal vaccine, and tuberculosis vaccine in that fill and finish plant. Lahat ng naimbento ng bakuna, yun ang pinakamas malinaw. Lahat ng naimbentong bakuna na binibili ng Pilipinas ay pwede nating i-fill and finish by year 2025. And after that, moving forward, dapat maka-imbento na rin tayo ng sarili natin, either through us or through the Virology Institute. So kung ano man yung bagong bakuna na yan na pwede nating i-mass produce sa planta natin. So ang example niyan is pwede tayong mag-imbento ng chikungunya, leptospirosis vaccine, or even malaria vaccine. Kasi yan yung mga diseases na talamak sa ASEAN. Kaya nga tayo meron ASEAN na grouping for vaccine self-reliance. Yung existing vaccine na pinoproduce natin through bulk fill, pwede nating i-produce yung antigen nun na nagmula na sa raw materials galing sa atin. So, ang difference nung formulation and production is that as a fully integrated vaccine plant is that we can formulate na our own individual aspects of the vaccine from raw materials. So, hindi na tayo bumibili ngayon ng bulto at isasalin lang. Within the next 5 years, so that is actually 3 years from the time na nag-fill and finish tayo, dapat tayo ay nakapag-formulate na rin ng existing vaccines. So, ano yung existing vaccines? For example, yung tinatawag nga na 5-in-1 vaccine. Dapat magawa na natin yan, hindi lang bulk finish. Dapat magawa na natin yan na formulate and produce natin from locally sourced materials. So, yun ang diferensya nun moving forward. So, which is mas mahirap, kaya it will take another 5 years. So, yun ay nasisiguro ko na magagawa natin within the next 5 to 7 years na makapag-produce ng local existing vaccines. Yun namang sarili nating invention. Maraming variables yan. Nakadepende yan sa, of course, sa ating capacity, kagalingan na mag-research and development. Meron namang mga ibang bakuna na mahihirap talagang gawain, umaabot ng 15 years bago ma-invento. Meron naman ibang bakuna na madaling na-invento, katulad ng COVID, 1 year lang na invento kaagad. So, depende yan sa anong klaseng disease ang gusto nating tirahin na i-produce locally kaagad. Tulad nga nung nasabi ko kanina, yan ba ay yung mga diseases na walang ibang nag-aaral dahil tayo lang ay bilang Asyano or bilang Pilipino dahil tayo lang ang naapektuhan yan. So, may mga ganong diseases.
Nabanggit mo kanina ang Virology Institute of the Philippines which the government has just created. Anong magiging interaction o relasyon ng Glovax with the Virology Institute of the Philippines?
Ang isang public agency na katulad ng Virology Institute ay complementary siya sa isang private company na mass production naman ang intention. So that's what is Glovax intended to do. We are doing the mass production, especially starting with existing vaccines. So the Virology Institute, sila naman yung nag-aaral ng mga bakuna na pwede nilang gawain na in the future pwedeng i-commercialize. So kung baga, tayo ang pwedeng maging producer nila tayo ang pwedeng maging marketing nila, mag-export and mag-commercialize. So yun po ang complementary effort na ginagawa natin. Hindi po tayo nagko-compete sa kanila sapagkat yung research and development nila ay funded po ng government para sa mga diseases na nakikita ng government na importanteng i-produce locally. Sa amin naman, yung research and development na ginagawa namin is for purposes of being able to mass produce vaccines. So magkaiba po yun. So sila nag-iimbento ng bago, kami nagpo-produce ng existing na. So kung ano man yung may invento nila, maima-market natin, maiko-commercialize natin, mai-export pa natin in the future.
Going back now to the ASEAN vaccine workshop which you attended last November, one of the items on the agenda was the ASEAN Vaccine Security and Self-Reliance Program. Pakikwento naman sa amin kung anong programang ito.
Yan po yung holistic approach na gustong mangyari ng ASEAN Security and Self-Reliance Project. Now that we have our own vaccine plant, hindi lang po tayo nanonood sa kanila na ngayon. Tayo ay magiging active participant na pwede na rin tayo mag-export sa kanila. So that's why ang agreement po doon is kailangan ma-manage yung volume ng mass production which is kulang pa ngayon. And ano yung mga expertise ng bawat isa. So wala po kasi namang talagang isang country na nakakapag-produce ng lahat ng bakuna available sa mundo. So yan po ay paghahati-hatian. And ang kagandahan po niyan ay napakalaking market, 680 million people ang ASEAN. So kaya na isip nila at mas mararapat na gawin daw ay magkaroon ng coordination. So para bawat isang country ay nakakapag-export without actually competing so much with each other. May competition pa rin, pero ang kagandahan ay nag-uusap na kunyari ang Pilipinas, for example, magaling sa pag-produce ng influenza, edi tayo ang mag-export niya. Ngayon naman, kung ang Indonesia ay magaling sa pag-produce ng tuberculosis vaccine or tetanus vaccine, edi sila naman ang mag-export noon. Paikot-ikot sa ASEAN. So, complementary at the same time yung ASEAN Security and Self-Reliance Project.
You make a very strong case for a vaccine plant and for self-reliance as a way to address vaccine security. E ang tanong, kaya ba itong patakbuhin ng mga Pilipino?
Nagulat nga ako nung ako ay nagpunta sa vaccine plant sa Thailand. Ang mga nagtatrabaho po doon ay mga Pilipino. So, sapagkat wala po tayong local vaccine plant. So, sa galing natin ito, kulelat man tayo ngayon, naniniwala po ako na makakahabol tayo at yan po yung isa sa mga magiging ipagmamayabang natin sa nalalapit na mga taon na nakahabol tayo ng mabilis.
Any party thoughts before we bring this interview to a close?
Prevention should be the first in mind, not cure. And if we are able to fast track and do this vaccine plan, preventive healthcare will be spearheaded and it will benefit a lot of Filipino by saving costs and also saving lives. And it's also beneficial to the government because on the ASEAN Vaccine Workshop, the World Bank and the International Finance Corporation made a study that for every peso investments in the vaccine plant, there's a equivalent 36 pesos benefit to the costs of the government in terms of universal health care. We cannot even quantify the value of a life saved, from preventing diseases and killing these people. So there's very good research that vaccination and prevention is really the way to go for the universal healthcare to be more cost-effective.
And that was a regional roundup conversation with Giovanni Alingog, founder and CEO of Glovax Biotech. Personally, one of the saddest phrases that's come out of this pandemic has been vaccine nationalism. The World Economic Forum politely describes vaccine nationalism as countries prioritizing their own vaccine needs. Al Jazeera was a bit more blunt, saying, and I quote, "Vaccine nationalism occurs when governments sign agreements with pharmaceutical manufacturers to supply their own population with vaccines ahead of them becoming available for other countries." In short, inuuna ng mga bansang may kaya at may kakayahang gumawa ng bakuna na sila ang mauna sa mga supply, habang ang mga tulad natin ay naghihintay na lang muna sa mga tira-tira. You may remember that other countries got their vaccine shots way ahead of others. Definitely way ahead of ours. But hey, I guess that's the way the world works. Which is why I am eagerly awaiting developments towards vaccine self-reliance. Actually, self-reliance, period. As COVID has shown, when push comes to shove, governments around the world tend to think of country first. Of course. Another reason to anticipate a vaccine plant of our own is this. I'd like to see more Filipinos thinking up, making, manufacturing more things, and selling more of what we produce to other countries. Because, and I share Mr. Alingog's optimism and confidence in the Filipino here, we can. This has been Bing. See you next episode of the Regional Roundup.